Hi everyone, thank you for joining us on episode 15 of our podcast called The Research Behind Lift the Lid, where we talk to researchers previously funded by Australian Rotary Health about their research findings. I'm Jessica Cooper, and today we'll be talking to Dr Tegan Cruwys from the Australian National University. Dr Cruwys was awarded an Australian Rotary Health mental health research grant from 2018 to 2019 for her project called Connecting Adolescents to Reduce Relapse, the CAR trial, an RCT to assess whether a social identity intervention reduces social isolation more effectively than cognitive behaviour therapy. Dr Cruwys is a National Health and Medical Research Council Emerging Leadership Fellow and clinical psychologist at ANU, with an honorary senior research fellowship at the University of Queensland. Her research investigates how social relationships shape mental and physical health, work that is at the intersection of social, clinical, and health psychology. So thank you very much, Tegan, for joining us on today's podcast episode. How's everything been going for you lately?
Great. Thanks for having me, Jessica. It's a real honour to be able to share the research findings. They're just coming out now. So, looking forward to chatting with you.
Yeah, it should be great. It was only just recently that you submitted your final report to Australian Rotary Health for this mental health research project on social identity intervention. So it must be very fresh in your mind. To start off, could you tell us a little bit about this intervention that you were trialling in this research?
Yeah, so it's called Groups for Health, and it's an intervention that some colleagues and I developed about 6 years ago now. And basically what we were trying to do is to provide a manualised way in which health professionals, both psychologists and other kinds of mental health professionals, could provide support to people who are experiencing loneliness and social isolation that is often associated with a variety of different mental health problems. So there's an increasing body of evidence that's been coming out over the last 20, 30, 40 years showing that there's this extremely strong relationship between loneliness and mental health. And even more so that it seems to go in one direction primarily, that people who become socially isolated are at elevated risk of poor mental health down the track, and also that it's a really significant risk factor for relapse as well. So we were interested to provide a way in which we could address loneliness, especially for young people, so that we could benefit their mental health down the track. And so that intervention was developed about 6 years ago, and this trial was to try and find out just how effective it is in delivering those outcomes.
And so I guess, part of that trial was comparing that intervention to cognitive behaviour therapy, CBT. I guess what were some of the main findings when comparing the two?
Yeah, so one of the reasons we chose cognitive behavioural therapy, CBT, as a comparator in this trial is because we'd already done a couple of trials with this program, Groups for Health, and found that it was effective just pre-post, so that people tended to see benefits over time. And then we compared it to just a treatment as usual control, which was a sort of quite a diverse bunch of things that people might already be receiving, but was sometimes CBT. But CBT is probably the most effective intervention that we have as a psychological treatment for depression at the moment. And so you want to set the bar high if you're coming up with something new. You don't want to give yourself too easy a time to show that something's working. You want to show that it's at least as effective as what we're already doing. And so that's what this trial set out to do, was to see whether this new intervention, Groups for Health, could benefit young people who are currently experiencing depression at least as effectively as what we currently have as gold standard practice. But we wanted to go than that as well, because our intervention is not just targeting depression, it's also targeting one of those key risk factors for relapse, so that is loneliness. So we wanted to see whether our intervention could be more effective than CBT in benefiting people's social belonging and their degree to which they feel connected more broadly.
And so I guess, was it effective? Like, what were those main findings?
Yeah, so we're just in the process of starting the analysis of the data at the moment, so to put together an academic publication on them. And I'm excited to say that indeed we're finding very positive effects of both interventions. So this trial involved a 12-month follow-up period. So we had 174 young people aged between 15 and 25 who were experiencing depression and loneliness come through our trial. And we're seeing in both of those groups, regardless of whether they were randomly assigned to receive CBT or Groups for Health, that they experienced significant and substantial reductions in their depression and their loneliness, and that those benefits are maintained at 12-month follow-up. So that's the most exciting finding, is that people tend to be getting great benefit out of both of these interventions. And even more exciting for those of us who are, keen to develop an intervention that's effective for loneliness, we are seeing particular benefits for Groups for Health, and that's emerging over time as well. So we're really only starting to see that at that 12-month follow-up mark. So interesting, I think, that CBT is effective for loneliness as well as Groups for Health, but it seems like Groups for Health has a bit of an edge when it comes to that 12-month mark.
And so because CBT is such an effective intervention, I guess, why would researchers look for other types of interventions when that's so successful? Why would you say? Yeah,
good question. And, as a psychologist, I'm a big fan of CBT. So this is by no means, the goal is not to prove that CBT is bad in any way. It's actually part of the problem we have, though, is that CBT isn't right for everyone. And in fact, it seems to be that young people in particular don't always find that it's a great fit for them in terms of their needs. In fact, we received feedback, and one of the partners we had in running this intervention was Headspace. And I thought what they said was a really good example of why we need an intervention like this. They said that some young people, when they come to Headspace, they're really coming because they want to make friends. They see it as a social environment where they might be able to meet other young people and connect with them. And so then when they find that actually the treatments on offer are mostly one-on-one therapy with someone who is a long way from their age, that can be a bit of a turn-off. That's not actually what they're looking for. And so an intervention like this that's run in small groups of young people together and really focuses on how they can connect with one another and build skills to develop their group-based connectedness more generally, that's actually a better fit with what a lot of young people are looking for. And since we know that loneliness is a major risk factor for relapse as well, it may be the case that over the long term, by addressing that risk factor, we might be able to keep people well for longer as well and actually reduce their risk of relapse.
Yeah, well, that sounds so important, and it seems to offer something else that CBT doesn't offer. So that's really great. I guess in terms of implications for the wider public, where do you think this intervention might go?
Yeah, well, we're shooting for the moon. We're very excited to try and make the intervention more widely available, and so offering training for health professionals so that they can run CBT in their setting. Groups for Health in their setting is a next priority for us. We're also in the process of bringing together a large number of community partners for a large grant, which would allow us to test the implementation of Groups for Health across lots of different sectors. So we're looking both at young people and working with organisations like Headspace, as well as older populations, and we're working there with organisations like Relationships Australia to try and see if we can actually implement this in real world settings right across the different kinds of organisations that are already running mental health support in our community.
Yeah, well, that's definitely what we would like to see from these research projects, seeing it get out there and be used and help real people. So yeah, that's really great to hear. Was there anything else? I guess you've got some publications in the works. Are there any other, research avenues that can lead on from this as well?
Yeah, no, so that's definitely our priority at the moment, is making sure that these findings are, rigorously evaluated in the peer review process and made available to the scientific and the wider community more generally. So that's a priority. One other kind of tidbit of finding that I thought was really interesting that I'll share with you is that just by coincidence, we had a sort of a quasi-experimental design around COVID. So the COVID lockdowns came into place when about 50% of our sample had already done their 12-month follow-up point, and then the other 50% of our sample hadn't yet done their 12-month follow-up point. And half were in each of the two conditions because they were randomised. And so what we were able to assess is whether there was any differences between the way people were dealing with their COVID lockdown, depending on which kind of intervention they'd had. And what we found is that the people who had done the Groups for Health program were protected in terms of seeing a spike in their loneliness scores at that 12-month follow-up point. So it seemed to be the case that this intervention was setting people up well to cope with future threats to their social connectedness, which is, of course, again, exactly what we would hope, is that we're giving people the skills that future and unanticipated threats and stresses that we might not know about yet, that they're actually better able to cope with those down the track.
Yeah, that's so important and so good to see, at a time like this, those findings. Yeah, that's great. And, it sounds like this project was quite successful, particularly in finding that the intervention can help with the reducing relapse in depression in young people. And I know it's always so important for our Rotarians, who are the primary donors to Australian Rotary Health, to know where their money is going. I guess, would you be able to explain to our audience why continuing to fund research like yours or something similar is so important?
Yeah, no, thanks, Jessica. I really can't emphasize enough how crucial this grant was at the stage of our research project. It's the different kinds of research funding that are available for research like this is, it's a landscape that's very complicated to navigate, and it can be very hard to secure funding. So for health research, for instance, another major government funder is the National Health and Medical Research Council, but the success rates for those grants are so low, often on the order of 8%, 11%. And that's when all of the funders, all the people who are applying for funding are doing great research and are competitive. And often the research that falls by the wayside is the stuff that is the most kind of on the edge of science. So not the safe stuff that is really confirmed. It's the stuff where people are taking risks and trying something new that finds it hardest to get funding, and especially that startup funding to get the initial evidence that something might be promising. And so for us, for this research project, we really wouldn't have been able to do this by any means without the support of Australian Rotary Health. So it has been really crucial for us and for this research.
Yeah, well, yeah, it's always really great to hear, from our researchers and, what has happened, with the research that they've done after receiving those, that funding and those donations from the Rotarians. So thank you so much for joining me today. And I guess, just before we wrap up, was there anything else that you wanted to add?
No, I think that's everything I wanted to say, Jessica. I think, it's not just benefiting, those 174 young people that were able to go through our trial, but hopefully, many thousands more into the future as we're able to make this intervention available more broadly.
Yeah. Well, thanks again.
Cheers. Thanks, Jessica.
Thank you so much for joining us on today's episode of The Research Behind Lift the Lid. It's always so inspiring to hear what researchers in Australia are doing to help make a difference to mental health and how they are helping us on our mission to lift the lid on mental illness. If you can, please continue supporting important mental health research like Dr Cruwys's by donating on the Australian Rotary Health website. Thank you for listening. Please join us again next time.